children continuing to suffer violence at the hands of adults, and in some cases from those supposed to protect and care for them. As we mark National Children's Day, there are calls for government to recognize violence against children as a crucial socio-economic problem. Now, the Nelson Mandela Children's Fund hosted the National Children's Day Dialogue to find innovative solutions to several issues facing children. And we're joined in studio by the CEO, Dr. Ncube-Nkomo, who has thankfully given us of her time for this important conversation. Doctor, thank you so much for your time this morning. The impact of this violence that we're seeing, I mean, the data speaks for itself. A week doesn't go by that we don't have a horrific story involving a child being vandalized in some way, shape or form, murdered, raped, and the list goes on. And it's not something that just started yesterday. It's been going on for a very, very long time. The impact of that on their mental and physical health of children, hearing about what's happening to other children, that is inflicted by those who primarily raise the children. What kind of impact are we speaking of from especially a mental health point of view?
Well, it's something that they live with for the rest of their lives if there isn't an intervention to help them process that trauma and give them the tools to move beyond the traumatic situation that they would have faced. And I mean, if you think about it as an adult, I mean, if you look at some of the things that just make you fearful and you want to trace back where that fear emanated from, you'll find that most often than not, it's linked to something you experienced as a child or something that you witnessed as a child. So it's the cost of the mental health. It's also the cost of violence to the society, to the economy as a whole. You know, the stats, 2015 stats that Save the Children released was saying that the cost of violence against children sits at more than 200 billion in South Africa alone. And then if you look at it worldwide, we're talking about trillions of dollars of violence against children.
Break that down for me in terms of cost, because I've had conversations around this before, and it's about the violent incident. Seems like such an awfully weak word to use it, that impacts the child at that time, because as you said, if it is not dealt with and they're not helped to process it going forward into adulthood, it comes back. It manifests in different ways, and that's where the rest of that cost comes from.
That's right. So we kind of, if you think of South Africa, we've focused a lot on the cost of gender-based violence in recent years and have not started to say, but where did it start and what is the cost of where that root lies? And that root, most of the time, is lying in what children experienced. Either it was inflicted to them or they witnessed it and they've normalized that and carried it throughout their adult lives. So we've got to intervene when they're still children for us to get to a point of having adults that can create safe homes and safe communities.
And as part of this dialogue, you also dug a little deeper to look at how there is a correlation between this violence against children and unemployment as well. Speak to me about that.
So we looked at what the effects of unemployment are and what also the causes are. So if you think of a child, and violence against children manifests in several ways. So if you think of a child who experiences violence in the terms of lack of food, malnourishment, right? From the time the mother is pregnant, that child is going to be underweight at birth. They're going to be stunted. They will not meet their development goals from both a physical and cognitive perspective.
And we all know we've got issues at early childhood development stage as well. That's an ongoing issue as well.
So that child will never catch up with their peers who are well-nourished and are coming from relatively safe environments. So a child that is malnourished, the chances of getting to matric, passing matric, getting into a skills or tertiary environment, the odds are greatly against them. So there's that link that if a child is not adequately nourished, both from a physical perspective as well as an emotional perspective, the chances of getting out of that cycle are really, really stacked against them.
You know, it's so traumatic being a child in South Africa. Just before my conversation with you earlier in this bulletin, we spoke to the spokesperson of the Eastern Cape Education Department, because again, there's been a case of, there's something like over 180 kids who just in the last few weeks have suffered food poisoning because they ate contaminated food that they've bought, obviously, from shops that are around the school. And it's such a complex problem because you can control the food being sold on the school premises, but what of the places outside of the schools? Because you can only control a child's environment so far. There are so many things in your everyday life in South Africa that is a threat to the South African child.
You know, as part of the dialogue that we had on Thursday, Janet Dupree, who's an international rights activist herself and professional, was sharing where South Africa sits on the child protection system spectrum. And our child protection systems make vulnerable children targets of exploitation. And what you've just said is just the evidence that vulnerable child is going to be buying food on the streets, no control on the quality of the food, and we have the food poisoning stories that you're talking about.
And this spokesperson then said, we're trying to encourage our children to rather eat at home. But what if there's no food
at home?
Right? And we all know that the food nutrition program at schools could only do so much. We sat with the situation during COVID where nobody thought of the fact that if kids are not going to school, they lose that 1 square meal or sandwich per day. And we had 9 million children that were going without food because we were in lockdown. How do we get to a point that we really see all of those government departments that speak to the welfare of our children really working together, making up a very simple list and saying, right, nutrition, mental health, tick, 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 protection of the school premises and that kind of thing. It is complex, but how do you eat an elephant? One bite at a time.
One bite at a time. And you know, Marcel, the Section 28 of the Bill of Rights is about children's rights.
Absolutely.
And in there, it talks about children have a right to adequate nutrition and shelter and basic services. I think the question for us is, what should we be learning from the countries that have gotten it right? Because as South Africa, what we're seeing in where we sit on that spectrum I was telling you about earlier on, is that we've got civil society being the main driver of children's rights because of the fragmentation that's sitting at government level. So the countries that have gotten it right are the ones where the welfare of children, there's a children's champion in the president or at that level, who's then able to coordinate the different government departments. Because if you've got different government departments and they say permanent secretary of health and one of social development and one of education, who is the one that's got authority over the other in that kind of setup? So we just do need a setup where there is a higher center that then coordinates all these different departments that have got touch points with children.
We did have a Ministry of Women and Children that various leaders have had a chance at that desk. What do we need to do, however, for that kind of thing to be more effective and not just a nice to have?
We have a Ministry of Women, Youth and People with Disabilities. And then we have an Office of the Rights of the Child that sits within DSD. And so can you imagine the Minister, say, of the Social Department saying to the Minister of Health or the Minister of Basic Education, these are the issues. That's where the center that holds, that's higher up, becomes important because they're all peers and each one has got their different focus areas. So we need to get that to integrate and be housed in a place where all of them can account and there isn't the, well, we're both ministers, so why?
Do you think that there's enough of an understanding that the welfare of children is not just because all children deserve a lovely childhood and that kind of thing, that it actually speaks to the economic health of the country as well as human rights and all of that thing? And once there's the political will and the political understanding of how important those two things are, finally we'll see the kinds of resources and commitment, more importantly, being thrown behind the welfare of our kids.
I don't think that we've got that understanding at political level and then at individual caregiver level. There isn't the understanding that a child today is an adult tomorrow. Even at corporate level, you know, we had our dialogue at the JSE and we were saying You know, we need to get investors to understand that investing in a child is investing in the future consumer of your goods or services. And if you can give that child a fighting chance of being an economically active human being, you've got a chance of having a future consumer user of your products and services.
Well, at least we've also seen a week of a lot of hope and fun for children, watching the Springboks tour through the country, and of course a lot of references to Nelson Mandela and how he believed the children really were the future and the role that sports can play in that. And that's really been encouraging to see South African men who all come from very different backgrounds, Siya Kolisi being the leader of all of them. That is also a need of our children, the ability to hope and to be inspired and to look up to somebody who perhaps has had a similar experience to them.
And you know, a child, all they need is one adult that's a safe place for them to help them build their resilience. And it's awful to be talking about resilience in the context of children, but we have no choice. And I guess the marching orders for all of us would be, which child am I a safe place for? Where they know that, you know, I can go to Aunt Linda and I can tell her this, and she's going to make me feel heard, feel valued, and listened to. That's what we need.
Thank you so much for your time, Dr. Linda Ncube-Nkomo, and of course the work that you and your team continue to do. Important ongoing conversations that we need to have, and more importantly, action to follow. The CEO of the Nelson Mandela Children's Fund. We thank her for her time this morning.